Hi, good evening. I'm Dr. Philip McMillan, and today I'm talking about autopsies and the fact that COVID autopsies no longer really seem to be being done. Why would that be? Well, I think it's the reality that the people who are dying at the moment around COVID could primarily be in the vaccinated cohort, and nobody seems to want to do those kinds of autopsies. I think they're afraid of what they will see. But from my perspective, for the viewpoint that I am looking at, I am very, very concerned about the fact that in the context of how the pandemic is evolving, we now have a huge issue with regards to understanding how disease presentation is occurring. For anybody who has been following me, I have been focused on a really critical concept, and I call it the storm, the spike triggered autoimmune response mechanism. This is a critical piece of the puzzle because people are still getting infected, people are still getting sick. But what is the mechanism that will occur with regards to what is the cause of their illness? And that's where I've been focused on this spike triggered autoimmune response mechanism. But anything to do with autoimmunity can largely only be found outside of blood tests looking at autoantibodies. The hardcore evidence exists in histology, studying the tissue, taking pieces of it to try and understand it. That's what we do, certainly in terms of diagnosing cancer. Not doing autopsies is the equivalent of stopping to do biopsies in cancer. How would we be able to know what kind of cancer we're dealing in, what it's sensitive to? Autopsies, the study of tissue, is the foundation of Western medicine. And stepping away from it can only lead to problems. And this is what I have seen in the context of the pandemic. Before I go further, please let me remind you that I want to make sure that you follow us in terms of this revolution. We want to make sure that you are joined up with us on this newsletter. And in this process, we will hopefully be able to show you lots of more valuable information over time. So please click on the link in the description below. Join us on this newsletter. Let us continue to try and share information that's of value. Getting back to the point here about the autopsies, what I've got here is a study that was done by the Japanese. I'm beginning to love the Japanese because they are so to the point. They just get stuff done. They're not afraid of the politics. They want to get answers and they look at the hard questions. What I've got here is a very interesting study when they were looking at COVID 19 pandemic pathology autopsy practices in Japan. This was actually done in 2022. So it was some time ago that this had happened. But the principles were very, very important. And what you will find is that they asked the question that I was asking early on in the pandemic. We needed autopsies desperately. I'll tell you one of the areas that I certainly was looking for autopsies was in what I called asymptomatic COVID. These were patients who would have COVID, and this was quite early in the pandemic. This is how they would present. They would potentially come for some other reason. Say, for instance, they had a chest X-ray or even a shoulder X-ray. This is what I saw in one particular situation. Person had a shoulder injury, had an X-ray, and it showed up in the background that there was a lung inflammation. They do a full chest X-ray and then they do a swab. The person had COVID. They had absolutely no symptoms. What we needed was autopsies if people died with COVID to look and study exactly what was happening in the lungs in that what we think is the subclinical or asymptomatic phase. Without that research, we were blind. There were a few places that did it, but we certainly didn't have enough. We're doing a similar mistake now in that people are still dying. The numbers are still up. Don't let anybody kid you about excess deaths. Excess deaths still remain elevated. And we don't know fully the mechanisms. Without autopsies, you are flying blind. So the question is, what really is the reason why we don't have these autopsies at this point? Here we have the abstract from this paper, and they were looking at autopsies in Japan in around COVID 19. And this was between December 2020 to January 2021. They sent out surveys. So this is early in the pandemic, for which about 227 pathologists had responded to it. And what they were finding out there is that the number of autopsies for COVID cases were down, as well as the autopsies for non COVID cases. There was a significant decrease, one observed to the pre pandemic period. This is very, very important because straight away, what was happening is that there were specific reasons why the pathologists weren't doing autopsies. And this is one of the questions that the Japanese asked. They were asking people, what really was the reason that you were not doing autopsies? So here's an interesting part of the paper. This is now where they were looking at the distribution of the number of facilities with confirmed or suspected COVID 19 autopsies. Confirmed autopsies here, suspected COVID 19 here. One autopsy, seven were done in one place. That's so for confirmed COVID. So you can see the total number, whereas one autopsy, seven were done, two autopsies, that was only in one place, and one facility did greater than five autopsies, 20% of them. So you can see across Japan, there were only a few. For suspected COVID cases, it was only nine facilities that did one autopsy. Four facilities out of the 277 did four, and you can see or greater than five. This was probably a teaching institution or something that had actually done that. But you can see straight away that this indicates that there was a significant drop off in terms of autopsies that were being done. The question is why? And this is again what the paper was looking at. So when they looked at the reason why, so they asked them what was the reason. And here you have the decision making algorithm for conducting autopsies of confirmed or suspected COVID 19 cases. So they looked at the percentage, the number of facilities in terms of the confirmed cases versus the suspected cases. The reasons. The first question was, were you allowed to conduct an autopsy? 79% of them with confirmed COVID 19, 180 out of the 277, were not allowed to conduct an autopsy. Another 104 couldn't do it because of facility and equipment limitations. So you can see there's an overlap between the reasons. Some of the reasons for not doing it were related to equipment limitations. Only 12% considered conducting autopsies on confirmed COVID. They considered it, but didn't actually do any studies with regards to that. In terms of suspected COVID, as I said, 110 out of the 227, 49% were not allowed to conduct autopsies. And the considering conducting an autopsy, 92 out of the 227, which is 41%, considered it. And therefore, 88, 39% did it after they had a negative test confirmation. Only 1.8% would have done it without a SARS-CoV-2 test. Now, that's very important because you just have to think about the logic of this now. Now, I can understand the institutes wanting to protect pathologists. They're going to be in a facility where they're exposed to these bodies, they're having to cut them open. Do they have enough protection? And I think I could have accepted that in early 2020. But the problem is that there was an expectation for the frontline doctors to face the virus on their own with infected people, and actually even without masks, it was okay. And so you had a situation where physicians, nurses were putting themselves in harm's way to try and care for patients. And we needed answers, but the people who could provide the answers were protected from being exposed. I can't understand the logic there, because we did need the autopsies. And one would have hoped that we would have done more and more autopsies. We're in a different situation now. Now, what's happening is that people are no longer so afraid of doing COVID autopsies because of the exposure. But I don't think they've necessarily changed the rules in the past 2 years. So you may find a COVID positive patient still can't have an autopsy in maybe up to 70% of facilities. That's a problem. Because where we are now is that I've always asked, when we know what happens from an autopsy point of view, the pathology, when somebody who was unvaccinated died of COVID. We clearly see the microthrombi, we can see the perivascular changes, we can see, in my view, the evidence pointing to autoimmunity with the cytokine storm. The question has been, well, how has it changed when people who have been vaccinated die of COVID? And they are dying of COVID. So, what is the mechanism? Is it exactly the same? Is it the same microthrombi? Is it the same ground glass inflammatory changes in the lungs? Is there any difference? If there is a difference, we need to understand what the difference is. If there is no difference, we have to understand, well, how can there be no difference after they were vaccinated? These are very important scientific questions. But without this kind of research, we are flying blind. And this is especially relevant when I mention to you the point of spike triggered autoimmune response mechanism. We are flying completely blind because you can't even explain it. It remains hypothetical without the research being done. These are serious times. And my worry is that by the time the seriousness of it is upon us, because it's like a storm surge, it's occurring, but people are saying, well, it's not too bad. Let's see what happens. By the time there is full recognition of this, the time it takes to do autopsies and to do histological analysis, it's not quick. And we will be without answers for a vast period of time. The implication of that is extremely serious, especially if treatment requires very strong immune suppression, because this is what I suspect is going to be needed. Nobody will do that if we don't have absolutely clear evidence that this is the right thing to do. So, serious times ahead. But as I say, autopsy, autopsy, autopsy. That's what we call for all the time. So, just a reminder for those who are interested, remember, join us with regards to our newsletter. The link is below. It is absolutely free, and we'll be able to share with you valuable information in the near future. So, have a great evening to everyone. Look forward to speaking to you again soon.